Okay, welcome everyone. My name is Dr. Seema Marwaha, and we're going to start our panel on COVID-19 vaccines with a focus on youth. I'm just going to start out after we welcome everyone to let you guys know that today's event will be in English, but live interpretation will be available in Hindi and Urdu. You can watch in Hindi either in Zoom or on YouTube. And if you are on Zoom and wish to switch to Hindi or Urdu, we're going to just take a moment now to explain to you how you can do so. We have our interpreter Freya on the line. So could you please explain how to switch to Hindi and Urdu?
Thank you kindly, Dr. Seema. आज की तकरीब इंग्लिश में मुनक्किद हो रही है, जिसके साथ बराह रास्त तर्जुमा हिंदी में दस्तयाब है। अगर आप हिंदी तर्जुमा सुनना चाहते हैं तो अपने कंप्यूटर की जूम स्क्रीन पे निचली लाइन पर ग्लोब का आइकॉन बना है, उस ग्लोब आइकॉन पर जाकर अपनी जुबान हिंदी का इंतखाब करें। और अगर आप हमारे साथ अपने फोन पर जूम ऐप के जरिए जुड़े हैं तो मोर के आइकॉन पर क्लिक करें या 3 नुक्तों पर क्लिक करें जो आपकी स्क्रीन पर निचले कोने पर बने हैं और फिर लैंग्वेज इंटरप्रिटेशन में हिंदी का इंतखाब करें और आखिर में डन को क्लिक करें। Thank you, Dr. Seema. Please go ahead.
Thank you very much. And just to remind everybody, we are streaming on Zoom as well as on YouTube. In addition, we are streaming on Y Media as well. If you need to access the links, you can go to our website, which is southasianhealthnetwork.ca. I'll just leave that up here for now. So let's get started. So my name is Dr. Seema Marwaha. I'm an internal medicine doctor, a journalist, and editor-in-chief of an online magazine called Healthy Debate. And I'm also one of the co-founders of the South Asian Health Network. And I could not be more excited to be moderating this panel on COVID vaccines with a focus on youth. I myself have a small toddler at home. But I would first like to start with a brief land acknowledgement. I want to start by acknowledging the land I am on. The land that I'm on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. The South Asian Health Network is a Canadian collaborative to enhance the health and well-being of South Asians as well as other racialized communities. We formed in late 2020 in response to COVID disproportionately impacting these communities, but we plan to continue our work long past when COVID is over. We specialize in creating culturally appropriate health educational content and public-facing advocacy to address structural inequities in healthcare and in public health. I'd like to first thank all of our partners, especially CASA, which is the Council of Agencies Serving South Asians, who've helped make this webinar possible today, as well as Toronto Public Health. And so now, without further ado, I'm going to introduce our esteemed and very qualified panelists and speakers today. So first up, I'd like to introduce Dr. Vinita Dubey. She works as an Associate Medical Officer of Health for Toronto Public Health, specializing with the Vaccine Preventable Diseases Program. She holds a medical degree from the University of Calgary and a Master's of Public Health degree from the Harvard School of Public Health. She also works as an emergency medicine physician outside the GTA and holds an adjunct professor appointment with the University of Toronto's Dalai Lama School of Public Health. We also have with us Dr. Nisha Thampi, who completed her medical training, pediatrics residency, and subspecialty training in infectious diseases at the University of Toronto at the Hospital for Sick Children. She obtained a master's in science degree in public health with a focus on health economics from the London School of Hygiene and Tropical Medicine, and returned to Toronto to do a clinical research fellowship with the Antimicrobial Stewardship Program at Mount Sinai Hospital within the University Health Network in Toronto. And she joined the Division of Infectious Disease at CHIO in 2013. First up, we have Dr. Dubey, who's going to do a short 5 to 7 minute presentation on building trust and vaccine confidence. And then we will move into our Q&A. So over to you, Dr. Dubey.
Great. Thank you so much for joining during this supper hour. I hope either you're eating along or had something to eat. I hope to hear all of the questions, but let's get started with just a few slides to kind of set the stage for what we know about these vaccines, and especially in youth. So if we could get the slide deck. Okay, great. Okay, so next slide. So when we talk about COVID-19, it is a virus. It's an infectious disease. It can make us sick, but actually it's more than a disease. And I think we can all relate and say that COVID-19 has made us all confused, scared. It's impacted our mental health. We've had some heroes who we've been able to celebrate. There's been unity and support, but overall, there have been a lot associated with this pandemic. And so when we talk about preventing COVID with a vaccine, it's not just about the virus, it's about all of these other things in which COVID-19 has impacted our lives. Next slide, please.
Just a little bit of a lag. There we go. Sorry about
No
that.
problem. Yeah. So we have the vaccines, and vaccines can help. And so the vaccines that are used in Canada are safe and they work, and we're going to talk very quickly about them. And the goal of the vaccination program really is to prevent us from getting seriously ill, from ending up in hospital or dying from these infections. Next slide, please. So there's power in numbers. This is actually one of my favorite slides to present. Maybe I'm a numbers person, but there's 1.45 billion doses of vaccines given worldwide, and that's in 174 countries. Of the vaccines given in youth, 3 million of the vaccines have been given to 12 to 17-year-olds. And in our own city, Toronto, where I work, 1.5 million doses have been given. And the reason why I tell you this is because for every dose that's given, I can at least guarantee for every dose that's given in the city, if someone gets seriously sick following a vaccination, we have a process in place to ensure that that's reported, that we follow up on it. And so if there is a rare side effect in 105 million doses that have been given, you can expect that we will be able to detect that. Next slide, please. So a lot of people wonder, how do we have vaccines so quickly? Clearly, they must have cut corners in order for it to be developed and approved so quickly. And so I want to spend just a very few minutes talking about this. So it's important to know that the vaccines that we have, the development started actually when SARS-1 started almost 20 years ago, when they realized we need to start working on a vaccine for coronavirus. So that was almost 20 years ago. The messenger RNA technology that's being used for some of our vaccines has been around for over 10 years. And so by the time COVID hit and we had the genomic sequencing that was released for this virus, researchers could get started on producing a vaccine, but they still had to go through the same rigorous process of a phase 1, phase 2, and phase 3 clinical trials. But instead, they did them at the same time, phase 1, phase 2, and then phase 3. So the results could all come back about the same time. They still had to enroll a lot of people. They had to follow all of the protocols. When the results came in, they could then be submitted as they came in to the regulators. Next slide, please. And so Health Canada had to take all of that data as they got it. They didn't have to wait for the whole package, and were able to review it and approve the vaccines. That's how they were approved more quickly than usual. Then when the vaccines are now given in arms, we have this ongoing safety system, which I've just discussed, to make sure as everyone gets a vaccine, does the vaccine continue to be safe? Next slide, please. So why are we talking about vaccine right now? Well, there's one really important reason, and that's because right now in Ontario, we are in our worst and biggest wave of the pandemic, wave 3. And what's driving this wave are variants of concern. You may have heard of this. And so we actually have a new strain of the virus that originated in the UK. It's called the UK variant. And we know that it spreads more easily and makes more people sick, including young people. And so what we also know, though, is that public health measures work. So wearing a mask, physical distancing, these stay-at-home orders, they're actually working. And so we have gone up that slope, and now we're on our way down. We're not all the way down yet, though. And vaccines now are one additional tool we have to help us, because we know that vaccines work against variants. Next slide, please. So how do we know that vaccines work against variants? Well, in Ontario, we mostly have the UK variant, and that variant is that's the variant that's common in the UK, where they're using the Pfizer and the AstraZeneca vaccine. It's also the same variant that's predominant in Israel, where they've mostly used the Pfizer vaccine. And we know that in these two countries, the vaccine efforts have been very effective to help them reopen their society. And even when variants change, there's a new variant, the vaccine can often provide cross-protection. And down the road, if there's a variant that's new for which our vaccines aren't providing the best protection, we could get a booster dose. Next slide, please. So how do these vaccines work? Well, they work by an instruction manual, actually. So the vaccine, the messenger RNA, is an instruction manual. It makes your body produce a spike protein. It's just a protein. So it actually can't make you sick, but your body then produces antibodies against that protein. The spike protein is then gone. The instruction manual, the messenger RNA, does not last for very long. And what you're left with are these antibodies that will help to protect you if you're exposed to the COVID virus. Next slide, please. So what is in the vaccine? Well, the vaccine has this very delicate instruction manual, the messenger RNA, for example. And so we keep it in a deep freezer to preserve it. We also preserve it by wrapping it in salts, sugars, lipids, and buffers. But look what's not in the vaccine. There's no egg, there are no gelatin, there's no preservatives, no latex, no antibiotics, no aluminum, no mercury. There's really a lot that's not in the vaccine. As well, there's no COVID virus. So you actually can't get COVID from this vaccine. Next slide, please. Now, will the vaccine make you sick? Well, we know it can't give you COVID because there's no virus in the vaccine. You certainly can get side effects, the commonest being a headache, a fever, not feeling well. About 20% of people can have that. The side effects, though, are mild, and they last 1 to 3 days, and then they go away. Now, rarely people can get a severe allergic reaction, like an anaphylaxis reaction, but that occurs within the first 15 minutes. And so that's why we keep you at the clinic for 15 minutes. So if you get one of those reactions, we can treat you right away. Now, if you have symptoms that are severe or that last longer than 3 days, that's a sign to get medical attention. Next slide, please. Now, what do we know about vaccines and use? Well, we know that in Canada, the Pfizer vaccine was licensed at the beginning of May for 12 years and older. It was already licensed to 16. Now the 12 to 15-year-olds were added. And as of today, actually, the announcement came that children and youth will be eligible to be vaccinated as early as this week, actually. Now, vaccination is not mandatory, and there are still going to be a large group of children who don't have a vaccine available. And so the best way to protect them is to vaccinate everyone around them, including their adults, and to keep following those public health guidelines. Next slide, please. What if you had COVID? Well, yes, we still recommend that you get vaccinated because the COVID you had may not protect you against variants. That immunity may not be long lasting either. And so that's why the vaccine is still recommended. Next slide, please. Okay, just a little bit on the Pfizer vaccine and the Moderna. They are both very similar vaccines. These are the two predominant vaccines that we will be getting in Ontario in May and June. The Pfizer vaccine is the vaccine that the youth will be getting. 140 million doses. So look at all those zeros. That's how many doses have been given in the USA. And there have been no safety signals identified with this vaccine. We know that the vaccine works. Pfizer, even with variants. And so if you book at a Toronto Public Health Mass Immunization Clinic, this is the vaccine that will be given. Next slide, please. And our goal is to reach community immunity or herd immunity. And what is that exactly? Well, if you look at this picture, the people who are blue are depicting vaccinated people. And the people who are green are unvaccinated and potentially contagious. A green person is surrounded by blue people. And so the green person cannot then infect the others because they're vaccinated. And that's what community immunity is. And the goal is to try and protect those who can't get vaccinated, like, for example, a baby. Next slide, please. So just ending off on misinformation, there is a lot of information on vaccines. Not all of it is true. There's also there's a lot of false information. So if you've heard about infertility and vaccines, your menstrual cycle and vaccines, that is false information, but has been spreading and has been making people doubt or question vaccines. So if you hear something about a vaccine, what you need to do is consider the source, read beyond the headlines, dig a little bit deeper, and then verify the information. And if you're getting your information from social media, from Instagram, Facebook, WhatsApp, it may very well have false information. Next slide, please. So by getting vaccinated, we can all be part of something greater. Your vaccine protects you, but it also protects those around you. And by getting vaccinated, we can all be protected together. And with that, I will turn it back to you, Seema.
Great, thank you so much for that. I mean, I'm going to stop sharing these slides for now so that we can sort of see everybody. But, you know, having events like this is our way of trying to combat false information and to put accurate information directly from sources like you, like Dr. Thampi, directly to the public. And so with that, you know, we've pulled some people and some of our audience members and some of the community that we serve to try to say and find out what are the questions that are on people's minds relating to the COVID vaccine and vaccinating youth, people under the age of 18. And so I wanted to direct the next string of questions towards you, Dr. Thampi. There's a few of them in a row because Dr. Dubey got to present her bit, so I have a couple. Some of them have already been addressed. So we know that adolescents, as Dr. Dubey mentioned, are going to be eligible. The announcement came out very recently to receive the Pfizer vaccine. Is the dosage and the scheduling going to be the same as adults, or does it differ in any way?
Right. So it is going to be the Pfizer vaccine. It's exciting. It's the first COVID-19 vaccine approved for use in adolescents. And the dose is expected to be the same, and the interval is expected to be the same as well.
And just to clarify, I know that it was mentioned before, but you know, we have the Pfizer and the Moderna mRNA vaccines. And for people between 12 and 17, it is Pfizer that they'll be getting and not Moderna. Is that correct?
That's right. And one dose, at least 2 doses, at least 3 weeks apart.
Got it. You know, the question on everybody's mind, my mind as well, having a 2.5-year-old at home, is what about the kids under the age of 12? And do we have any information about when we'll have vaccines for them and sort of what research we're gathering to help us with that?
Right. So first off, I'll say that I will no longer predict when a vaccine will become available to them, because it is quite remarkable, all of the intense work and collaboration that's gone into getting vaccines approved and getting through that the red tape when we know the results have been so remarkable. For young kids, there are numerous vaccine trials underway, and predominantly Pfizer and Moderna for 6 months to 11 years old. And that's going to be a slightly different process, because part of the work will be determining what dose is optimal for protection and whether we need to do any boosting, so additional doses. And then there's going to be the review from Health Canada and the approval, and further review and recommendations, as Dr. Dubey has pointed out, from the National Advisory Committee for Immunization. So, I can say ballpark, maybe end of year or beginning of next year, that we can expect to hear about vaccine data and maybe even approval. But I am preparing for younger kids to have another winter season without a COVID vaccine. And in my mind, it's all the more reason for them to get their flu shot, and for older people around them to get their COVID and flu shots.
Absolutely. And Dr. Dubey mentioned this concept of herd immunity and how if everyone else gets vaccinated, it'll protect people who don't have a vaccine eligible for them yet. I too have stopped trying to predict when things are going to happen, because we are really just, it's like light speed science that's happening, which is remarkable to see.
I mean, I'll just point out that it is light speed science, but it's with the same rigor that we've always applied. So that, and in my mind, that's reassuring as a mother and as a pediatrician and an infectious disease physician, like just to see all of those steps are still being ticked off and rigorously applied is reassuring.
I mean, that's a great segue into the next section of questions that are still for you. Dr. Thampi, you're not off the hook yet. And Dr. Dubey, please, you can interject if you have anything to add. But, you know, it's a section on efficacy and safety of vaccines for youth. And we'll focus it on who the vaccine is eligible for, which is age 12 to 17. So what does the efficacy and safety look like in adolescents based on what we know? And is it any different from adults?
Yeah, so it's actually shown high efficacy against symptomatic COVID-19, similar to adults. And so from that perspective, it'll be important, like it'll play a really good role to protecting adolescents from symptomatic COVID-19 disease and then reducing community spread. Mm-hmm.
A lot of the people that we talk to on the ground, you know, they agree that that the vaccines are necessary, but when it comes to their children, they're a little bit more hypervigilant when it comes to side effects. And as a mother, I mean, this resonates with me as well. Mm-hmm. And so I'm just wondering, you know, how do we manage the potential side effects from vaccines in children? Is it any different?
So, you know, we talk about being mothers on this panel, and I think one of the things that we learn very early about are side effects from vaccines, because our kids go through the routine immunization programs from either from birth, if they need certain vaccines at birth, or at 2 months and beyond. So the side effects that we're hearing about in older kids seem to be similar to what we've heard about in adults, and I would manage those the same way when they're mild side effects. You know, manage them at home, and there are questionnaires that we're all getting once we've had our vaccines, and I would encourage people to fill them out, because hearing about even the mild side effects helps our vaccine adverse events registries to get more information on how well the vaccine is tolerated in our population. Anything serious, I would recommend reviewing with a healthcare provider. They may be related to the vaccine, they may be related to COVID-19, and they may be completely unrelated. But being able to sort through that on our own or with Dr. Google can be pretty unreliable. So I would highly recommend connecting with a healthcare provider in those circumstances.
And it was mentioned by Dr. Dubey too that, you know, around 20% of people experience side effects that are mild, relatively mild, and gets better in around 1 to 3 days. Could we expect something similar from what we know about children?
Yes, that's what I would expect too, and that's what we've heard from the American data that was just put out last week.
Phenomenal. I mean, the other thing that we hear about when we are reading headlines about side effects is blood clots, blood clots, blood clots, blood clots. Are there any concerns with the vaccines available for youth, the Pfizer vaccine and blood clots?
Right, with the mRNA vaccines, among the 3 million youth above age 12 who received the vaccine so far, we've not heard about these side effects.
I think that'll be really reassuring for people to hear, because I know people are reading about it a lot, and it can get a little bit confusing. Mm-hmm. The other question that we get really commonly, in addition to side effects around safety, is we talk about how this is an mRNA vaccine. So people are wondering, you know, does this alter or cause any changes in your own DNA? People seem to be quite concerned about that.
Right. I really liked how Dr. Dubey talked about the mRNA vaccines. Like, they basically teach our cells how to make a protein, but they don't actually, the vaccines are not delivering the virus that causes COVID-19 into our bodies. And they, you know, and these pieces of protein trigger the immune response, but they don't actually get into our DNA. So no, that's not a concern that we have. It's not been, it's not part of the vaccine delivery to do that.
Not a concern in adults, not a concern in children. No. So what about children who are immunocompromised, who have underlying medical conditions that cause them to have a weakened immune system? Do we know if it's safe for them to get the vaccine?
We believe it is safe, and that's based on adult data as well as pediatric data. So we've had kids both in Canada and in the US who who have immunocompromising conditions and who have received the vaccine and have tolerated really well. So I'd say the vaccine is safe for most people, including anyone who has a medical condition or taking medications. But the other piece that I'll say is that, while the vaccines may work well for them, they are even more protected when the people around them are immunized. So people like other teenagers or older adults who get the vaccines will add to the protection for the child who's immunocompromised, and especially if they are not old enough to be eligible for the Pfizer vaccine.
So that's like a really nice description of how the vaccine protects you individually, but can also protect those around you as well. Would that be correct?
Similar themes will keep coming up.
Okay, this is good. It's almost like you can't hear this stuff enough. I mean, there's so many reasons with which to get vaccinated. Last question just along this before we open it up to both of you guys is, so a question we got is, what if my child is due for another vaccine like hepatitis B or the HPV vaccine? How many days do you have to wait before getting another vaccine, and how does that alter, sort of when you get the COVID vaccine?
So my brief answer is that we do not need to wait between doses, which is going to be really helpful. I mean, I'm sure Toronto Public Health and other public health units are trying to figure out if there is a way for us to be able to deliver the HPV and Hep B vaccines and the COVID vaccines to in schools where we've already had these pre-existing programs. But the short end of it is that we don't need to wait between doses.
Got it. I mean, that's a good segue. I mean, Dr. Dubey, do you have anything to add specifically about that, since you were mentioned about other vaccines and administering the COVID vaccine to 12 to 17?
Yes, I mean, some people have talked about, in schools in grade 7 and 8, we give sometimes 3 vaccines together. Can we now give 4? Right now, the recommendation is that you only get the COVID vaccine because, what if you have side effects? Well, which vaccine are you having a side effect to? It's often hard to tease that out. We also want to make sure that you get the best immune response to all of the vaccines. So we can expect that there may be more data coming out that can help us decide whether we call that co-administration, give vaccines at the same time. So that may change in the future, but for now we're saying just the COVID vaccine.
Okay, so just to clarify, so for now, just to separate side effects and things like that, we're recommending to not get the COVID vaccine together with other people, with other vaccines that may be given around the same time. Is that correct?
That's right. That's the current recommendation. Yeah.
Got it. It's a good next segue now into just general questions about vaccines. And some of this you've talked about already, Dr. Dubey, in your slides, but NACI recently recommended a 4-month delay between the first and second dose of the COVID vaccine for everyone, I believe also including those who are 12 to 17. And so we just wanted to get your thoughts on that.
Sure. So just disclosure, I am a volunteer member of NACI, so I do sit on that committee, so just so everyone's aware of that. So there's only one reason why NACI made that recommendation, and that's because of vaccine shortages. Like, it was vaccine supply shortages, and we were in the midst of the 3rd wave, and we didn't have enough vaccine to be able to offer to large groups of people. And so based on, it was data informed, based on data that showed that the first dose actually gives very good protection. The CDC actually came out with a study that showed that 1 dose of a messenger RNA vaccine gives you 80% protection, 2 doses 90%. So, and it's not that, and so we know that protection is strong, and it's not about to fall off a cliff after, say, 2 months. All of a sudden you go down to 0. Vaccine immunity, when it goes down slowly. And in that time, it allowed us, with these very scarce vaccine resources, to vaccinate more people. And by vaccinating more people, we could then help to drive infection rates down, to get a handle on this wave 3, and also to kind of get to that herd protection, which is what we're really trying to achieve right now. But as vaccine supply increases, as it improves, we can certainly shorten that interval. Like, that interval was not fixed. Now, there was data that just recently came out, though, that showed that a slightly longer interval between doses may actually be more beneficial. Does it need to be 4 months if we have enough supply? Probably not. But is 3 weeks long enough, maybe not either. So it's probably somewhere in between there. That's the golden spot.
And this is an example of how we're learning as we go as well. Just jumping off of that question. So in between your two doses, like if they're 4 months apart, you mentioned 80% protection, not over 90% protection with both doses. How should you be following public health guidelines in between your two doses, especially if that interval is longer?
Right now our case numbers are very high in Ontario, and especially in Toronto, they're still very, very high. And so one dose gives good protection, but it still is not 100% protection. And when the rates are so high, we need to continue following those public health measures. I think until our rates get low, can we ease up? Now, the Public Health Agency of Canada just on Friday released some guidelines on this. And so they said in the spring, which is where we are right now, our case rates are high, our vaccine coverage rates are low, and so we need to get as many people vaccinated and follow the measures, which includes stay-at-home orders, which is what we currently have and are working. By the time we hit the summer, we will reach a place where we'll have more people with one-dose coverage, one-dose vaccine, and hopefully the rates will be lower. And so then we can start thinking about having more outdoor activities, even with people we don't live with, because the outdoors we know is safer. And then as we hit the fall, we're going to expect that we're going to have more people who have had 2 doses. Our numbers are still going to be low. And then we can start talking about indoor gatherings, having a small party, for example. And so that's kind of the trajectory that we can start to plan for, to hope for. Actually, there's a lot of hope in that.
Thank you. Yeah, that's quite clear. And I do recall a graphic circulating from what was released on Friday that we can also share with the audience. I also just wanted to go back to Dr. Thampi just for 1 sec. With the 4-month delay between the first and second dose, would those same guidelines apply to children? So 4 months being okay to wait, and also having the same sort of efficacy of vaccine despite waiting the 4 months in between?
Yep. So I think, the second question is easy to answer because we've actually seen that kids tend to have fairly robust immune response, like to vaccines, which is a good thing in terms of effectiveness. But I don't know that the vaccine, that the 4-month interval will be applied to youth, especially if we have vaccines available, as Dr. Dubey has pointed out. But and I think the press release last week from the government was encouraging about having the second dose available to the teenagers before the start of the school year, which would certainly be less than 4 months.
Yeah, and it's nice to know that as supply goes up, that those intervals might shorten, and it's really nice to know that as case rates, Dr. Dubey, as you mentioned, come down, that we might be able to do more. So, I mean, that's also quite reassuring. Thanks for sharing. I mean, do either of our panelists want to walk us through this since we've put it up there? Dr. Dubey, do you feel comfortable, or Dr. Thampi?
So this is actually what I was talking about. So the first one is the spring case rates are high, vaccine coverage is low. So we stay at home, we stay safe, and we get vaccinated. The middle is the summer, cases are low, vaccine coverage is high for 1 dose, and more people are getting that second dose. So we can do things like go camping, hiking, picnics, patios. And then in the fall, our cases are low. We have 2-dose vaccine coverage that's high. And so when we can go back to university, go back to colleges, indoor sports, family gatherings. So yeah, that's exactly the information that I was referring to. So thanks for sharing that.
Yeah, and it really does illustrate like what both of you have mentioned, is that there's an individual benefit to getting vaccinated, and then there's also like a community and a population benefit, and this sort of really illustrates that nicely. We're going to move on to just a couple more general questions that people have that we get commonly, and it creates a lot of confusion. So how long, Dr. Dubey, does immunity last? And do you anticipate that people will need to get booster shots? And as the variants evolve, will booster shots be on the table? I know this is a moving target, but it's a really common question. So we're really curious to hear your thoughts.
Okay, well, I would first say 2 doses are better than 1. And so we all have to make sure that we get our second dose, get our first dose first, but make plans for the second dose as well. We know that that with the second dose, that immunity will last at least 6 months. And you're saying, well, 6 months is not very reassuring. Why is it just 6 months? Well, we actually haven't had the vaccines around for very long. The Pfizer and Moderna trials were last summer, so they haven't even been studied for more than a year. And so we can definitively say that they will last that long. The immunity seems to be good, that it's going to last for longer than that. So the question then remains, well, what about the vaccines, or what about the virus? Are we going to have variants? And so you really can't predict new variants that may come. But if we do end up in a situation where there is a new variant for which our vaccines are not providing good protection, well, then yes, a booster dose can be given. I don't think there's any reason, I don't think you can definitively say, yes, booster doses every year or every 5 years, or it's really too early to be able to predict that. But it is an option. And I think that it's a good option so that we don't end up in this place again with stay-at-home orders, for example.
That's really helpful. And then speaking of how long immunity lasts, if someone's already had COVID, you mentioned they may be immune for some time, but it may not last very long. Should they still get the vaccine? And how long should they wait after they recover to get the vaccine?
Yeah, so immunity from a natural infection can last, say, 3 months. It's hard to predict per person, but usually we say at least 3 months. Some people have gotten COVID more than once, though, and so we know that that immunity is not guaranteed to last, and we can't always guess who is going to have long-lasting immunity. We also don't know if the immunity that you get from a COVID infection will protect you against variants, for example. And so by getting the vaccine, it's actually like a booster dose, actually. So it will boost your immune response to the COVID infection you had and give you a longer lasting protection.
And Dr. Thampi, do you think that that is similar for children who have had COVID as well, that they are also safe to get the Pfizer vaccine age 12 to 17 after contracting the infection?
Absolutely. We would follow the same guidance.
And then, another question, and this is directed towards both of you, adults as well as adolescents, is can people still get COVID and test positive for COVID after getting either one or both doses of the vaccine? Maybe we'll start, Dr. Dubey, with you.
Sure, yeah. Yeah, so I mean, the vaccines are not 100%. So it is obviously always possible that you could get COVID being vaccinated. So a couple things to say. One is, if you get COVID and you're vaccinated, you're very, very less likely to end up in hospital or to die from COVID, which means the vaccine worked because it kept you from getting that severe illness. And that really is the goal of the vaccination. But to put it in perspective, so there was a recent analysis that was put out by Public Health Ontario that looked at the last 3.5 million doses that were given in Ontario until the middle of April of COVID vaccines. And 0.06% got COVID. So about 2,000 people out of 3.5 million got COVID after vaccination. Of those, about 2,000 people, almost 70% got it in the first 14 days. And we know in the first 14 days after your first dose, you're not protected. And so that's when most people got their vaccine. And so again, we have to remember, just because you're vaccinated, the moment you're vaccinated, you don't have protection. It does take 2 to 3 weeks to get protection. The number of people that got COVID, we call it 7 days after your second dose. So when you were considered fully protection, was so small. And again, no severe illnesses in that analysis.
And my follow-up question to that is, so say after your vaccine dose, you do get some non-specific side effects like fever or myalgias, or even a cough. Should you go and get tested for coronavirus if you are in a hotspot neighborhood, or should you wait? What's the guidance we should be giving people there?
Yeah, so I actually just reviewed this today because, some places are offering different guidance. But the point is right now in Ontario, especially in Toronto, right, where I work, the case rates are still high. And so if you had a fever after your vaccine, well, yeah, it could be your vaccine, but it could also be COVID. And really the best way to ensure that it's not COVID is to get tested. But as the case rates go down, you know, like we'll be able to, again, if the fever is mild, if it's just a bit of aching, nothing else, if it lasts for just 24 hours and not longer than that, then we can move to a place where it's probably just a vaccine reaction. But then in the midst of this third wave where there's so much COVID circulating, we really do have to still make sure that any symptom is not COVID.
Absolutely. And then Dr. Thampi, I just have another quick follow-up question. So like I have a small child who does or was attending daycare. And then occasionally we would get these letters from Toronto Public Health. Maybe Dr. Dubey, you had signed those letters saying that there had been an exposure. And so sometimes, you know, we're not sure what to do with that when we get the letter sent to us. Sometimes it tells us we have to do things, other times not. So, you know, if you have a child who's in daycare or in a school who has an exposure, what should families be doing? And Dr. Dubey, please feel free to jump in as well.
Well, Dr. Dubey is going to let me answer this to see how well I follow the rules too. No, I'm just kidding. But the bottom line is to follow the public health guidance. So if there's been an exposure, then the concern is that what that means is that someone who had been in the daycare, whether it's a staff person or another child, was diagnosed with COVID-19 infection and had been in daycare during the period when they were considered contagious. And so even though today your child looks well and your child may remain well throughout, it is possible that during that period of contagiousness, that your child had picked up the infection from whoever was in close contact with them, because that's the other piece. It's either within their cohort, which at that age everyone's in close contact, or with a staff person who is in close contact with the child. And so following the public health guidance it remains critical. So isolating and getting tested at the right time, you know, with whatever measure is available. So in most places, it's the nasopharyngeal swab, which is a deep back of the nose swab. Some places have saliva, depending on the age and the public health unit, and then other places have a cheek, mouth, and nose swab. But bottom line is they need to be isolated, and what that means for parents becomes complicated because, you know, it's easier for an adult to be isolated on their own than it is for a baby or a young child. And so a number of public health units have put out some really good guidance on how to be isolating with your child. So if there are two parents in the household, you know, having one parent designated as the caregiver to that child. But oftentimes that can be hard to separate out depending on where people live. And so it may be that the household becomes, you know, takes additional measures to either isolate or do their essential work, but not more than that. And so it's easier to speak about it now because, you know, we're in a lockdown and extracurricular activities are no longer there and stores are no longer open, but it definitely was a point of communication and education with families before. It probably will be as we start to think about and look at reopening. Did I get it right, Dr. Dubey?
And I had a jump off question for Dr. Dubey. Dr. Thampi, you're off the hook for a sec. So the two things that we often hear from parents is if they've been vaccinated, do they still have to get tested, or does that change the guidance at all? And sometimes you get parents on the flip side who are extra worried. And so even though the public health letter says you don't need to do anything, you likely weren't exposed, we're just notifying you, they still sometimes feel anxious and want to go get tested. So the bottom line is to follow what the public health guidance is directing. Is that my understanding?
Yeah, so usually the guidance is based on how public health has graded the risk, the level of exposure for the child. And if they were someone who was in the daycare, someone else was in another room, they tested positive, but you know, your kid didn't really have much to do with it, it would be different guidance compared to if it was someone in your room, yes. But in terms of, you know, if you're vaccinated, if the parent is vaccinated, what does that mean for down the road? And you can expect that the guidance is going to change. Yes, I mean, we've just recently started getting changes in guidance in long-term care homes, for example. So if someone who lives in a long-term care is vaccinated and their caregiver who comes to visit them is vaccinated, they can now hug. I mean, it's really fantastic, you know. So we've been making changes, and you can expect, and there are also guidelines out there for workers who are vaccinated and what their screening tool will look like, for example. So yes, you can expect that being vaccinated will have a different, public health will provide different direction. We've seen a lot of that in the US. We haven't seen a lot of it here because we frankly don't have very many people who have had 2 doses, but it will come, it will come.
And similarly, another question that we have received is, can we see our friends and family after we get both doses of the vaccine? Whether you're a youth or whether you're an adult, I think everyone has that question. So Dr. Dubey, what do you think?
Yeah, I mean, that's going to be part of the plan. Absolutely. Like, get our rates down, get 2 doses in people, and we can start having indoor gatherings or meet outdoors. Absolutely. That is part of where we want to go to. And vaccines are going to play a big role there. Yes.
So part of it is the vaccine uptake, and part of it is also like how much COVID is in the community. Is it both of those things?
That's right. Yeah.
Okay, we're going to move on just to the last section, and thank you for indulging all of those questions. And some of these will be directed towards you, Dr. Dubey, because they're about rollout. And then I think you're not off the hook yet, Dr. Thampi. There's still one more question for you before we open it up to some of our participants. But so on accessibility, so Health Canada has now approved a few vaccines, so Pfizer, we talked about for ages 12 to 17. So how will those children and their parents know when it's their turn to get vaccinated?
Okay, well, there's going to be a rollout. There's going to be a good rollout. I spent a lot of my day today talking about the youth vaccination rollout for the city where I work, and that's going on all across the province. And so you can expect that youth will be able to be vaccinated in multiple venues, just like for adults. So at immunization clinics, at special clinics. I know Sick Kids, for example, is planning clinics for some of their clients who attend Sick Kids, for example. Pharmacies may be able to provide vaccines to youth as well too. Hopefully, family doctors and pediatricians will be able to be vaccinated, though that won't happen in the short term. And then there will also perhaps in some places be school clinics as well too. So the actual logistics of it haven't been worked out. The other one that will be really important is pop-up clinics. And so I think you can expect that the current infrastructure, if there's a pop-up clinic in a hotspot neighborhood, they will now extend the ages. And so there will be more to come on that. So there will be a number of different ways, either through booking an appointment, through pop-ups, based on where you get care, for example, to get the vaccine.
Got it. And I'm assuming that, as we know more, there'll be information available from Toronto Public Health and maybe also from the ministry?
Absolutely. Oh, yes. Communication will be really important to make sure that parents are aware and that the youth themselves are aware as well.
We talked about it briefly. I mean, this question is directed towards both of you, so whoever would like to answer it. But the relationship between vaccinating adolescents and the return to in-person learning. So, will it be required, do you think, for knowing that we don't have a crystal ball for what September is going to look like? Do you think it will be required for children aged 12 to 17 to need to be vaccinated before in-person learning happens again?
So I'll take a stab at this one because I think it's all weighed heavily on us how challenging this school year has been for students and for parents and for educators and other school staff. And so knowing that vaccines are an important way for us to drive our rates down along with our other public health measures. Vaccines are certainly going to be encouraged, and especially given their safety profile and their effectiveness, they're going to be encouraged as a way to help us get back to a new normal and to school and extracurricular activities. I don't foresee them being mandatory, but I think it's also part of our social collective that we want to encourage kids to get back to the things that have helped them to thrive all these years. And whether it's school or extracurricular activities or hanging out in different in different closed spaces, vaccines add a really important layer of protection. And so we would want to be able to offer that to them to be able to get back to those activities as soon as possible.
Dr. Dubey, anything to add there?
So just from a public health perspective, in Ontario, we have this act. It's a provincial act called the Immunization School Pupils Act. And so there are a number of diseases for which you are required to be vaccinated or have a valid exemption. Now, I don't imagine by September that they will add the COVID vaccine into that list, but that's something that could occur down the road. It's hard to say. You know, there also might not be enough time for everyone to get their second dose by September. So I'm not sure that it will be vaccinated or no entry to school. Absolutely not. But certainly highly encourage you to get vaccinated so that your return to school and everything else can be very smooth.
It's nice to know, I mean, that you guys are both so aligned in your answers with that. Similarly, I have one more jump off question. So, you know, like raising a child myself during the majority of his life has been during the pandemic. You know, when do we anticipate, knowing that we don't know when kids under the age of 12 will be vaccinated, when can we anticipate that they might be able to have indoor activities again? You know, like circle time and libraries being open and things like that. I know a lot of parents have those questions, and I know it might be difficult to answer, but do we see a time in the future where for our younger kids who will remain unvaccinated over the summer, where they might be able to comfortably be in group environments again? Maybe Dr. I'm trying to read you.
Sure, I'll start. Yeah. I think we're not even through the third wave, and we're talking about a pending fourth wave, which frankly, I find that it's difficult to think about that, but I think what we have to expect is in the fall, we get respiratory viruses that do spread. And so recognizing that there will be a group of people, large group of children who won't have access to a vaccine, that there will be some measures in place. I have to imagine that. Now, what's that going to look like? Maybe it's going to be a screening tool at the door. Maybe you can have circle time, but it will be physically distanced and the caregivers will wear a mask, or, it's really hard to predict. But I think a lot of it is going to depend on what our COVID numbers are like. And if they are very low, it will allow us to do a lot more. But if they are high, it will restrict us. And so I think that is going to be one of the things to really watch for.
Yeah, and why all the other public health measures in place are so important as well.
Yeah.
Well, I think, we do have some questions that are coming directly from the audience in real time. And so I'm going to put them out to both of you, and whoever, has an answer. I know that it may not be possible to answer them directly, but let's go through them and see. So the first one is, have we seen any cases of myocarditis in youth, like in Israel or the US? Is it possible that not enough youth have gotten Pfizer to pick up a safety signal so far? The person who's writing this question is asking because their 17-year-old is getting Pfizer on Wednesday, and specifically concerned about kind of new risk factors that pop up, like what happened with AstraZeneca. So I'm not sure if either of you guys have an answer for that question, but
so in the more than 3 million kids 12 to 17-year-olds who've had the first dose, and then from the study who've had second doses, we haven't seen that signal. So that's there was a myocarditis concern among Israelis and US military personnel, among young people, and it hasn't appeared among these other groups of younger people vaccinated across the US, in Israel, and even in Canada, because we have been vaccinated 12 to 17-year-olds. So, we haven't seen that signal, but that's why our surveillance programs exist, whether it's this signal or other signals, to be able to pick up on any vaccine-associated events and to be in constant communication with other parts of the world where these vaccines have been rolled out well before ours, and to be able to share experiences almost in real time.
And Dr. Dubey, I mean, you mentioned that you also sit on NACI, who does a lot of the evidence surveillance for vaccines. So just maybe any points there about how we monitor vaccines when they're rolled out to make sure that they continue to be safe?
Yeah, so actually it's the Public Health Agency of Canada that monitors this, and they actually release every Friday their updates of the summary of their surveillance. So that's actually free to everyone to look at. And there have been no, so what you're trying to look at is, you know, of the 18 million doses given in Canada, has there been a higher than expected rate of myocarditis noticed in those who were vaccinated? And you really have to compare it to what occurs in general, and you're looking for, that's what we call a safety signal, higher than expected. And there hasn't been one identified for myocarditis. And so again, in the US, 140 million doses given, you know, in Europe, how many, in the UK, how many, right? And so these are that many more doses than were given even for AstraZeneca. And so I think that's the other thing to note. The US has been vaccinating 16 years and up for longer than we have, including their young adults, 18, 19, 20, who are probably very similar to a 12, 13, 14-year-old. And so, you know, we're going to continue to monitor, but there hasn't been, other than those ones that Dr. Thampi talked about, there really haven't been others that have been identified. But it's not that we're not looking for it.
That's really helpful. Thank you so much. Another question that we have is very specific. So can COVID-19 vaccination cause any form of brain degeneration?
I've not heard of this side effect related to COVID-19 vaccines.
Yeah, and I think when we talk about effects on the brain, we also, like, sometimes you can get very much caught up in these risks or potential risks, things that you've heard about the vaccine, but we have to balance it with what we know about COVID. And we know that COVID can actually affect your brain. It can affect your brain, your heart, your lungs. And you can get strokes. You can certainly impact your brain with COVID. And that's really the conversation that needs to occur, is your risk of getting COVID and your risk for getting, if it's your brain you're worried about, your brain getting impacted by COVID. That's what you actually really need to balance as well when we think about some of these concerns that people may have about the vaccine.
That's very helpful. There's a second, more specific question as well. Someone has asked, the Toronto website says that we need a doctor's letter for youth 16 and 17. So the first question is this true? And the second is, this person has a 16-year-old who works at a grocery store. So she wants to know when her 16-year-old can get the vaccine, and does she need a letter?
No, it's not true that you need a letter. So I have to update that website. I thought I did all the updates on Friday, so I'm sorry that that's up there. No, that's certainly not something that we're requiring now. So someone who is 16 or 17 and meets the criteria for essential worker, actually working in a grocery store means that you're an essential worker. You can actually book to get a vaccine at one of the Toronto Public Health clinics. They all have Pfizer, and because you meet the eligibility criteria, not because of age, but because you're an essential worker, you can certainly get the vaccine. And I will go scouring on my website and update it. So thanks for clarifying that.
Yeah, definitely. And feel free to send the link as well, so that Dr. Dubey doesn't have to go scouring for it. We have another question that's come in, not about vaccines, but about asymptomatic spread. So if someone is asymptomatic, how long can that person be infectious and spread the virus to others? I'm gonna direct it towards either of you guys. Dr. Thampi, do you want to take that one?
Yeah, I have to say it depends. It depends on where they've been picked up in the course of their illness. So, you know, some of the most helpful studies were done early on during the pandemic and showed that, and they followed people from the time that they had been exposed to the time that they started to shed live virus. And they found that most people stopped shedding you know, at 7 days, but by 10 days, if they had healthy immune systems and they were not considered immunocompromised. Immunocompromised individuals have been shown to shed for longer. And so this is, you know, these studies were in individuals who had no symptoms, who had mild symptoms, and then who had more significant symptoms. So the thing is, if you are asymptomatic, if you have no symptoms and you've gone for your test, it's not clear where in that 10-day period you've fallen, or we're catching that positive result. And so given the spread that we have in our community, the lack of immunized people around us, the recommendation is to start the isolation period from that point. I'm pretty sure of that, but from that point onwards, for asymptomatic individuals from the test positive date, because we don't want to say, oh, well, you're probably at the end of it and that's why you're asymptomatic, so it's fine for you to go forward, because they may actually be in the beginning of their period of being contagious to others.
Got it. So we just assume from the day that they test positive asymptomatic, and they wait the full isolation period to be on the safe side. Is that correct?
Mm-hmm. Yeah, so we do 2 days before their symptoms start to the 10 days after their day of test. But I think this question is so intriguing because it shows why something like a vaccine is so crucial, because, you know, some people never develop symptoms. So you actually, in the best contact tracing, can't ever identify where you got that infection because that person that didn't know either. And so I think it just really speaks to why we need a vaccine to control this virus compared to some other viruses.
Yeah, and then in addition, from a pediatric perspective, children and youth, you know, about 1/3 to 1/2 can have no symptoms and yet can still be spreading infection to others, whether it's in their activities or in their home environment. And so all the more reason to support vaccines for them.
Great. We have about 10 minutes left, so I'm just going to put a call out to everyone watching. If you have questions, we only have 2 more to answer, and then a couple of other questions that I have listed from that were pre-prepared. So if you have questions, please post them in the Q&A because we will be able to answer them in real time. So we have the 2 more questions that I have. So there are reports in the press mentioning that in spite of having 2 vaccines, a double dose, some people do fall quite sick with the virus. I know we got into this a little bit, but the person is asking, what's the explanation for why they get sick if the vaccine is supposed to protect you? Maybe this can go to Dr. Dubey.
I can start to say, you know, so we've actually looked at some of our data in Toronto and looked at some of the variants. And we know, for example, the Pfizer vaccine has good protection against the UK variants. What about the Brazil variants, or what about the South African variants? So sometimes getting sick despite having the vaccines can be because it's a variant. Sometimes it could be because the person who got vaccinated didn't develop an immune response. And we know that those who have a weakened immune system, for whatever reason, either it's because they have an illness, because they're on chemotherapy or different drugs, they don't develop an immune response. So the vaccine doesn't protect them as well as it may someone else. And then they could get quite sick with it. So I think there are other, and then the vaccines are not 100%. So, you know, most people will definitely be protected, stay out of hospital, but there is that small chance that that won't happen. And again, it just leads to our theme of why, you know, really having other people protected around them is important.
Yeah, like whole households and whole communities of people. The last question is, I'm not sure if you'll be familiar. I'm not as familiar, but I'm going to ask it anyway. So someone's asking about black fungus. And this is, why is it associated with COVID-19 vaccination side effects in India? They're asking this specifically because it's making youth, specifically international students, hesitant to get the vaccine in Canada.
It's a good question, but I'm going to kind of separate it from a vaccination side effect. It's actually, well, it's an unfortunate consequence or complication of COVID treatment. So in COVID, when people are sick with COVID-19, what's becoming the backbone of our response, our treatment for it is immunosuppressive therapy. And so we suppress their immune systems with steroids and with tocilizumab. And with these therapies, we may introduce a risk for them to develop fungal infections, because fungi or fungus is typically unable to cause an infection in an immunocompetent or a healthy, an individual with a healthy immune system. But when we've knocked down that immune system, it allows the fungal infection to proliferate and to establish itself and cause significant problems or even death if the right treatment isn't started and if it's an aggressive form. So yet another point for COVID-19 vaccines and trying to avoid the therapy, the infection, to be able to avoid the therapy and the potential complication from the therapy.
So just to clarify, oh, sorry, Dr. Dubey, go ahead.
No, please clarify. No, I just wanted to add that in India right now, the vaccination rate for 2 doses is 3.5%. That's their coverage rate. It's a very, very low. And so I just wanted to add that piece to say that despite how many vaccines they may have given, they have a very large population. And so so what is more common is the infection. So yeah, please clarify again with Dr. Thampi.
Definitely. So just so the black fungus that people are talking about doesn't really have much to do with the vaccine, and it's not a side effect from the vaccine. It's more related to the treatment of COVID. So it shouldn't impact people's decision to get vaccinated if they're an international student here in Canada. Is that correct?
Absolutely.
So not a concern, not related, and secondary to COVID infection and not the vaccine.
COVID infection and the treatment, yeah.
And the treatments associated with it. Okay, that's very helpful. Just so we're almost wrapping up. So just I have one more quick question, two more really quick ones, and then I'm going to ask you guys to give your sort of closing remarks. So I want to end on a little bit of a positive note. So I mean, we have children, this is about youth who have been doing school from home, many of them, and locked down on and off for a year now. Any tips, Dr. Thampi, for parents to just go a little longer? They can be personal or they can be clinical, but like, how do we /I make it through the next couple of weeks?
I think keeping our goals discrete and very short term, right? So no big plans or big changes, just day to day to day. People are falling at different points on the coping scale. So some families are coping really well with the transition, but we're hearing more and more, especially with more restrictions or lockdowns, that it's becoming harder to cope. And so I as much as I'm thrilled about vaccines being available now to youth, I think it's coming at significant personal costs to youth and to families. And so in terms of being able to cope with this next period of time, I can tell you in my family, we're keeping our head down, doing the day-to-day. In our public health unit, they told us back in January, perfect has been canceled, right? So just do what you can with the resources that you have, but perfect is canceled while we're in this crazy state of affairs, and really helping our community to come together and rally around the public health measures, which now include vaccines, which was not an option a year ago. That just makes the summery weekend even more sweet, even though we were still isolated. We could feel better days ahead. And that FAC guidance that came out on Friday about what the spring is going to look like, to be able to have that summer and then potentially that fall, like, it's still asking us to take individual action, but our individual action is going to get us to the end that we want to see. So that's how I've been keeping my chin up.
So continue to take it day by day, be cautiously optimistic that the future is going to get a bit brighter for us. Would that be accurate?
With every measure that we've been taking so far, right?
I mean, I really like that. My last question is for Dr. Dubey. So just about mixing of vaccines. I mean, a lot of people are asking, what if you get one dose of one or one dose of another? So you got AstraZeneca, what are you going to get next? But there's also people coming from like international places, maybe in smaller volumes, who are wondering about mixing doses. Just any early guidance on that? I know that research is still ongoing.
Yeah, so I mean, as much as you can, we recommend that you complete the series with the vaccine that you got, if you know what it is and if it's available. And if it's not, there's actually going to be further guidance coming out. We do know that we're waiting for a study in the UK. I mean, I think the biggest group that's impacted are those that got AstraZeneca for their first dose, because right now we don't have a lot of AstraZeneca, and some people may choose not to get it based on the safety signal. And so the preliminary data from the UK showed that one AstraZeneca, then one Pfizer, or one Pfizer and then one AstraZeneca, you can actually get more of a headache, more of a fever, get a bit more side effects that are short-lived. But we're waiting now to see, well, does it mean the vaccine works better? Some people think because I got more of a sore arm, that means that mixed schedule works better. We don't have the data on that yet, but it will be coming, and it will be coming in time for when those second doses are due for potential mixed schedules.
We got one last minute question in the chat. I'm going to stick it in there and then we'll go to our final thoughts. So as a healthcare worker, someone's asking that their second dose of Pfizer was February 19th. Given that there's a 6-month probable immunity, I am concerned that my booster dose due August 19th will be due before others have had their first or second dose. Will I be able to get my booster in August?
So there was recently announced that certain healthcare workers are eligible for an earlier second dose, but second doses are not being booked past the 4-month mark. So that is for sure. So if your second dose has been booked at the 6-month mark, I think you should follow up with where you had your first dose. But some healthcare workers are getting that shortened interval now that's being planned right now for some healthcare workers.
And then just to clarify, because I'm not clear in that question if she's asking about a booster, which would be a third dose, or if she's asking about her second dose. So we're not giving any booster third doses. Is that correct? And then for second doses, it's 4 months. For some healthcare workers, it may be shorter. And if you've been waiting 6 months, maybe you've been waiting too long.
Yeah, we're not recommending that you go beyond the 4-month mark. Yeah.
Got it. So, I mean, that brings us to the end of the questions. And I just want to thank you guys sincerely for the time. And I'm just hoping, could we each take a final minute with each of you and just give us sort of your final message or thought you want to leave the audience with in regards to COVID vaccines and a focus on youth, which was the theme of this panel. Maybe we can start, Dr. Dubey, with you, and then close out with Dr. Thampi, and then I'll make some closing remarks.
Yeah, so I mean, we've all been impacted by COVID. Like, there's no question about that. We all have a story to tell. Someone who I can say personally that I've had many of my colleagues, a parent has died, someone who was otherwise healthy, and I don't want to hear about another one of my colleagues' parents dying. I personally, I've been impacted, and that's why my getting vaccinated and my family getting vaccinated is important for me. And I think we're all going to have our own stories to talk about why vaccination is important for us. And so I just urge you all to think about, what is your vaccination story? If you have questions, get your questions answered, and then share your story if you get vaccinated, because you may encourage others as well.
Thank you. Dr. Thampi?
So very similar to Dr. Dubey, just enough personal experience and hearing from colleagues. Like I said, it's this spring has come after a year of very significant personal cost, and I see vaccines as, well, it's not just myself, but I'm impressed to hear from young people how excited they are to be able to access the vaccines, not just to protect them, but to protect their family, to protect their elders, to protect their coaches. And I'm really grateful for that community spirit. And I think Dr. Dubey gave excellent resources that we can direct families and young people to in order to have their questions answered. But yeah, just I'm very appreciative of this forum, because it's not often that I get to have a conversation or even hear from Dr. Dubey herself. So thank you for the opportunity.
And I think with that, I mean, this is going to come to a close. I just want to sincerely thank both of you guys for your honesty and sharing your wisdom with us. I'm quickly going to share my screen just to show last few couple of slides before we end this. So I'd like to, I'm going to go back. So I just want to say thank you again to our two speakers. We have a town hall tomorrow, same time, different Zoom link though, which can be found on our website, about COVID-19 vaccines and reproductive health with Dr. Murthy, Dr. Brohl, moderated by Sabina Vora-Miller. And then you can check out our website for all details. There's a place right on the main page where it takes you to virtual town halls with all the links. You can access this town hall and all of our previous ones, the YouTube streams from there as well. And then we can't end this without acknowledging what's happening in India. We do have resources on our homepage about ways to help, ways to donate. And then there's also a Managing COVID at Home resource that was put together, including some physicians from here in Canada that could be of use when talking with your family, friends, and colleagues back home. And with that, we'll bring this to a close. Thank you guys very, very much again, and we're looking forward to tomorrow.
Thank you.
Thanks so much. Bye-bye.